Welcome to Asepsis and Infection Control. When we discuss infection prevention, we have to start with discussing the chain of infection, the process required for an infection to happen in a person. To have an infection the first part of the chain of infection is the infectious agent, the thing that can cause the infection. There are three types of infectious agents: bacteria, viruses, and fungi. Bacteria are the most significant and most prevalent infectious agents in the healthcare setting. Viruses are the second most common, and these are the smallest of all the microorganisms we have. Lastly, we have fungi, which are plant-like organisms that are present in the air, soil, and water. They're pretty hard to acquire in the healthcare setting, and the ones that are present in healthcare are really nasty and they can cause death. There are also parasites, which live in or on a host and rely upon the host for its nutrients. These are pretty rare in healthcare. They're usually spread by stagnant water or in tropical locations and not usually healthcare. The next part of the chain of infection is the reservoir. This is the natural habitat for the organism. This could be other humans, animals, soil, food, water, and inanimate objects like countertops. We're able to stop the chain of infection from infectious agent to reservoir by things like hand hygiene, sterilizing equipment, wiping down dirty counters and toilets, and the use of anti-infectious agents. The next part of the chain of infection is portal of exit, which is the point of escape for the organism. How is it going to leave its reservoir and move to another location? And humans, this can be respiratory, gastrointestinal, genitourinary, any breaks in the skin, and through blood and tissues. We can stop the chain of infection between the reservoir and the portal of exit by using transmission-based precautions, which we're going to discuss later, along with sterilizing supplies or by using single-use only supplies. Once the organism has a way to leave its reservoir, it needs a way to move to another reservoir, its means of transmission. This can be direct contact, meaning actually touching the other person or touching something that has the organism on it. This can be a person-to-person touching, sexual intercourse, kissing, childbirth, medical procedures, or blood. The next type of transmission is indirect. This is when we touch something that has the organism on it after it's left the reservoir. This can be dirty linens, beds, meal trays, toilets, anything the organism can land on and stay there. Their transmission can also be airborne, where the organism is spread by tiny droplets through the air, and they're so tiny that they stay in the air. And this can be from sneezes or coughs or even finely sprayed blood in certain circumstances. Lastly, we have droplet transmission. This is when there are large drops of the organisms that are too heavy to stay in the air, and this could be caused by coughing, sneezing, or even talking. We can stop the chain of infection here by using personal protective equipment, sneezing into a tissue or into the corners of our arm, covering wounds with dressings, and of course hand hygiene. The next part of the chain of infection is portal of entry, which is the way the organism enters a susceptible host's body. This can be any break in the skin, the nose, lungs, reproductive organs, GI and GU tracts, and the eyes. Any place that the body has access to the inside of the body. We can stop the organisms from getting into the portals of entry by using hand hygiene, refrigerating our food, using pesticides to kill bugs that can spread infections like mosquitoes. The last part of the chain of infection is susceptible host. This means the person the organism has gotten into is able to become infected. Their defenses and immune system have been overrun by the organism. There's a lot that goes into this. The host itself has to be in perfect working order to not get infected. Their skin and mucous membranes must be intact, and the body's pH needs to be normal. The body's immune system also needs to be functioning perfectly. Any alteration in one of these makes the person susceptible to infection. In addition, age, biological sex, and hereditary factors affect the body's ability to protect itself from infection. Being under stress, fatigued, or sick already makes the person susceptible, as well as the environment the person is in and the nutritional status. Lastly, the use of any indwelling or invasive medical devices makes the person susceptible to infection. To help stop the organism getting into the portal of entry to the susceptible host, we use hand hygiene, gloves, personal protective equipment, and we properly dispose of our medical equipment. So looking at all of this, there's a lot that has to go right for an infection to spread, and there's a lot we can do to stop the chain of infection from happening and causing an infection. And we call all of this asepsis. Asepsis is everything we can do to prevent infections or us actually trying to break the chain of infection. There are two types of asepsis in healthcare: medical asepsis and surgical asepsis. Medical asepsis, also called clean technique, involves procedures that reduce the number and transfer of organisms. This includes hand hygiene, wearing clean gloves, and other personal protective equipment. We use this technique with any patient care that we could potentially spread organisms to us or other patients. The second type of asepsis is surgical asepsis or sterile technique. This is when we use practices like autoclaving to make sure the objects we use have zero microorganisms, and also cleaning the body part we're working with surgical grade cleaner to kill off any skin flora. We would be using this for surgeries or other invasive procedures like inserting lines and tubes into the body where infectious agents should not be living. In Block 1, our sterile asepsis procedure is inserting indwelling urinary catheters. In Block 2, you're going to do tracheostomy care and IV insertions. In Block 3, you're going to do central line dressing changes. And these are all procedures nurses do that require surgical asepsis. I've mentioned hand hygiene several times over the last couple of slides, and that's because hand hygiene is critical for breaking the chain of infection. It's because of several things. The first is we carry normal skin flora on our skin. It's flora that is specific to us, and if we don't wash our hands, we could spread our normal flora to another person, and it may cause them infection. Even though it's totally normal for our body, it's not normal for their body. If we wash our hands, then the skin flora washes away and we don't spread it. Also, hand hygiene rinses away any non-skin flora organisms that shouldn't be on our skin and cause infection. Because it's so important to wash our hands, the World Health Organization identified 5 moments of hand hygiene. These are the 5 times we should always be doing hand hygiene: before we touch a patient, before we do any clean or aseptic procedures, after body fluid exposure, after touching a patient, and after touching patient surroundings. That seems like a lot of hand hygiene, and it is, but we're terrible with hand hygiene. So bad that almost 2 million people a year in America get an infection that could have been stopped by hand hygiene, and 100,000 of those people will die because we didn't wash our hands. And that's horrible. The reason why infection prevention and hand hygiene is so important is because we have some major healthcare associated infections and some very scary and deadly drug resistant organisms. Healthcare associated infections are infections that occur in the healthcare settings caused by us. The column on the left lists the healthcare associated infections most prevalent. In Block 1, we're going to discuss catheter-associated urinary tract infections, or CAUTIs, and Clostridium difficile, or C. diff, infections in the GI and GU lectures. Both of these infections occur because of nursing care and poor hand hygiene. The column on the right lists the infectious agents we have that are so resistant to the medications we have to treat them that we're running out of medications. That means people are dying because we don't have the medications to kill off the organisms. These organisms can kill patients and us, so we really have to be careful not to get these infections and not to spread them. So to help protect us and the patients from infectious organisms in an effort to break the chain of infection, we have personal protective equipment, or PPE. Depending on what we're doing with our patient, the organism they have, or what we're trying to prevent them from having, and the way the organism spreads, or the way it's transmitted, will decide what PPE we're going to wear. PPE includes gloves, gowns, masks, and protective eyewear. It could also include shoe covers in the operating room. Just because we have PPE to protect us, PPE does not substitute hand hygiene. We must do hand hygiene even if we have PPE like gloves to protect us. The next couple of slides we'll discuss when we would wear our PPE. So the first part of PPE is it's only as effective if we use it and we use it correctly. First, we must put it on correctly. Putting on PPE is called donning. We don PPE. First, we do our hand hygiene, then we put our gown on. Then we put on our mask or respirator if needed. Then we put on our goggles or face shield if needed. And lastly, we put on our gloves every time. So this process doesn't change, and it is dictated by the CDC. And if you look at the little picture here on the slide, that is the actual CDC's picture on how we apply our PPE. When we remove our PPE or doff our PPE, we need to make sure we do this very carefully or we risk contaminating ourselves. This is probably the most important part of PPE is taking it off. The CDC has 2 ways we can doff our PPE. Your skills book discusses the first example on your left, and make sure you follow your facility's policies and procedures on which way they want you to use. The first example on the left has you removing your gloves first, then removing your goggles or face shield, then you will remove your gown, and then your mask or respirator. Again, you're removing what you used, so if you didn't use a mask, then you're going to skip that step. The second example on the right has you removing your gown and gloves together at once. This is the method I and most people use. It does take some practice as you are removing your gown and your gloves at the same time, and you have a higher risk of contaminating yourself. However, it's the best method to use if you only have a gown and gloves. After the gown and gloves come off, you remove your goggles, your face shield, followed by your mask or respirator. Standard precautions are the precautions we use for every person we care for, regardless of their diagnosis or possible infection status. This is going to include hand hygiene, wearing non-sterile or clean gloves when touching blood, bodily fluids, excretions, secretions, contaminated items, mucous membranes, and non-intact skin. We must change our gloves between tasks on the same patient as necessary and remove our gloves promptly after use. We will wear additional PPE during procedures and care activities that are likely to generate splashes or sprays of blood or body fluids. We'll wear gloves to handle used patient care equipment that is soiled with blood or identified body fluids, secretions, and excretions to prevent transfer of microorganisms. We'll clean and reprocess items appropriately if used for another patient. And we're going to follow respiratory hygiene and clean cough etiquette. This applies to any person entering a healthcare facility with signs of illness, including a cough, congestion, rhinorrhea, or increased production of respiratory secretions. We should educate patients and visitors to cover their mouth and nose with a tissue when coughing, dispose of used tissues promptly, and to use hand hygiene after contact with respiratory secretions. Please be mindful that when we do parts of our assessment, like palpating temperature, if we have gloves on, we can't feel temperature. So you don't have to wear your gloves 100% of the time. And I know that there are some people out there who feel like they cannot be in a patient's room without gloves, but just know you can't do all of your assessment if your gloves are on 100% of the time. In addition to standard precautions, we have transmission-based precautions. These are extra precautions we take for organisms that can be spread by one of the 3 transmission processes. The first one we'll discuss is airborne precautions. Airborne precautions are used for diseases such as tuberculosis, varicella, measles, and possibly SARS-CoV. These can all be spread by tiny particles that are so light and tiny that they stay in the air and people walking by can breathe them in. When we care for people with these diseases, we must do hand hygiene, wear gloves, wear an N95 mask that has been fitted to the healthcare worker's face, and wear a gown. The room should also have negative pressure ventilation to not allow the air to leave the room and spread the organisms, or at a bare minimum, the door to the room must remain closed at all times. Droplet precautions protect us against the large, heavy droplets of organisms that people cough or sneeze out. Even talking can spread droplets. Organisms like the mumps, rubella, diphtheria, influenza, and pertussis are all spread by droplets. For a person with a droplet-transmitted organisms, we must do hand hygiene, wear gloves, mask, and eye protection. Depending on where you work, you may also have to wear a gown. So I want you to follow your policies and procedures. Contact precautions protect us against the organisms that spread by direct or indirect contact with the patient and the patient's environment. We do this for many drug-resistant organisms: MRSA, E. coli, shingles, lice, scabies, norovirus, and so many more. Basically, if they can spread an organism that we don't want spread, we use contact precaution, again, following our facility policy. We're going to do hand hygiene, wear gloves and a gown. We'll also have a dedicated patient equipment like a stethoscope and blood pressure cuff because we don't want to bring any organisms out of the room with us if we're using our own stethoscope. All the linen that leaves the room is also considered contaminated, so that goes into linen bags in the room and it isn't carried around the unit. And this is the end of asepsis and infection control.